Hey, welcome back to our podcast, Project Brightside, where we always look on the bright side, even when things are looking pretty dark. I'm Dr. Shelby.
And I'm Richard Brito, and we're your hosts for today's episode.
Topics of discussion for our podcast include society and culture, education, and TV and film.
Each episode of Season 2 will have an interview of a guest speaker followed by a Bright Talk segment where we discuss a complicated topic in hopes of shining light on it.
For today's episode, we'll be interviewing Dr. Samantha Thompson. Hey, welcome to our show, Dr. Thompson. How are you doing today?
I'm great, you guys. Thank you for having me. I'm doing great. How are you guys?
Really excited to have you. So, to start us off, tell our listeners a little bit about yourself and what you've been up to professionally in the last year.
Hi, I'm Sam Thompson. I'm a clinical pharmacist in ambulatory care, and I am a professor of pharmacy, advanced pharmacy practice for Florida A&M College of Pharmacy Institute of Public Health. I'm also a grant writer. So in the last year, I've started my own business as a grant writer, contracting, and what I specialize in is opioid abatement. So addiction specialist. I train on Narcan, and I also get funding for different places across the nation that need funding for different areas of clinical work,
That's awesome.
help patients. Yeah, it's fun.
That's awesome. That's a really important topic, too, and one that I hope is kind of gaining more traction in pharmacy school and in medical school.
Yeah,
So.
grant writing is huge, and the fact that you've made a business on that's amazing.
You guys could do, anybody can do it. You just make an action plan and you figure out how to make objectives and you seek them out. And it could be education. It's usually stuff that you guys do every single day.
Definitely have to hear a little bit more about it. Our next question is, what kind of obstacles have you faced and how have you overcome them?
Honestly, I'll touch on the professional first and then I'll move into maybe like light personal, but professional. Pharmacy is really pivoting right now,
Mm.
especially with like a lot of stuff with AI. Um, and the way the market is moving, we're not really seeing the value of pharmacists anymore. It's not emphasized anymore. When I was in school a million years ago, way back then, it used to be we used to be the number one and I think number two most trusted profession, healthcare profession.
Mm.
Um, and now that's not the case. Another obstacle that we're seeing is a lot of pharmacy corporations are not seeing not corporations, but a lot of places where a lot of pharmacists work, especially like in retail, we're not seeing companies gather around in the value of an actual retail pharmacist. Retail pharmacists have to know about a little bit of literally every single disease and they're
Yeah.
not getting what they need as far as not just only financially sometimes, but support wise. So it's always good to make sure that we cover and educate not just our pharmacists, but the community about how important a pharmacist is. Um, Personally, mixed with the professionally, as a Black woman in this profession, sometimes especially at different jobs I've had. It's kind of hard and you both are younger. I think what you're going to see moving forward is a lot of people misinterpret and often take your youth for granted as if you don't have the experience. You're building the experience, but also your youth could be weaponized against you as if you're too young to know something.
Yeah, I
So,
totally understand that, especially with
yeah.
family. It's like I really appreciate you saying all of this because you're putting attention to, stigmas that are actually out there with pharmacy, but in reality, like there's ways to, manipulate any field. And especially with pharmacy, like it could do so much good, really targeting, populations with education on the labelings and like how to read it, with treatment adherence. That's a big issue, especially with minorities, like where they're either not getting access or not getting the treatment adherence that they require to be able to treat the illnesses and diseases that they have. So pharmacists are very important, and what you're mentioning is very important. So overcoming those stigmas and navigating the system that we're in right now, because in the USA it's very prominent where there's this stigma with big pharma, or with clinical pharmacy there's so many ways that you could actually cure diseases and illness and go through clinical trials, figure this out in peer review process. But the stigma with big pharma is that there's this not going through the research process or ethical process, but you still have to get approved with the regulatory aspects of research. So there is, more attention that's needed. And I think you're doing exactly what you're supposed to be doing. You have all the necessary skills to gather people and inspire businesses, with your grant writing. So I'm curious, what exactly drives you, in this profession and having to everything that is thrust upon you or thrown on you in this field?
What drives me is my students drive me, even though, every
That's awesome.
I'm a I'm a I'm what's called a geriatric millennial. So
Do
I
not look
remember
like a geriatric
I'm
millennial.
a geriatric millennial, pushing 40. So like I sit there and I'm like, I listen to older people who were like, oh, millennials, they are just complainers. No. Now I'm older now, so now I'm like, oh, this generation does this and this generation does this. And the generations over time have changed and my students have changed. I have to consistently pivot and restructure how I facilitate learning.
That's
So that
awesome.
keeps me sharp
Yeah.
on what's going on. One, two, what keeps me going are is honestly the political climate has pushed me so much now
Hmm.
where I have to keep pushing for advocating for minorities, especially in now of a time with DEI. I'm from Chicago,
Hmm.
so Florida is not new to me after 15 years, 17 years almost. But with everything changing right now in this region very fast, it's very difficult for a lot of my patients to feel like they can trust us.
Hmm.
So keeping that trust to help you with adherence, as you said earlier, Richard, that's also what drives me. But the one thing that kind of gets me up in the morning is because I have a practice site, and this
Hmm.
practice site is, when I tell you, you all, is so awesome. I'm at St. Vincent's, and I teach medical residents. I have a class of 30,
That's awesome.
and the preceptors who have been physicians for 20, 30 years, they trust me so much and they depend on me so much for any type of a question. And it just drives me because they really know that we as pharmacists are here to advocate and help. We're not boundaries. So that that helps me kind of keep a bridge, especially with all of the medications and treatments now that keep getting denied by insurance. So why do I have to have this prior auth? Why is this happening? Why? And they see it as obstacles, and they are, but one person that can kind of navigate through it and able to get their patient what they need, that just really helps me. But I will tell you what doesn't motivate me is the money. If you get into this profession or in any type of medical profession for the money, you're in it for the wrong reason.
Mhm.
And I'm glad you say that, because there's a lot of stigmas out there where, right now the price cap was removed and medications went up for a lot of people that can't afford it. That's too much. But you're mentioning here how, like, if you're going into pharmacy for the money, don't go in it for the money, because it's not really, unless you're actually like working for like the pharmaceutical companies that, don't really.
I think
They don't prioritize patient care as
Yes,
they
yes,
prioritize an actual bottom line.
yes,
I
yeah.
think it's hard sometimes for people to separate, for example, no no hate to any particular like pharmaceutical or insurance company, but kind of separating seeing their pharmacist from like the people who are leading these big pharmaceutical corporations, or separating your doctor from the CEO of the hospital or the head of whatever insurance you want to say. And so I
Yeah.
think there's a lot of mistrust there, but I also think it's so important to have people that are in the minority that look like you, that you can they can trust you, and that just comes a little bit more easily, I think. But I would imagine that if there was already a level of mistrust, that seeing somebody that is a minority as well might help a little bit for somebody, at least
Yeah.
representation for other people to join the field.
It does. And it's also a way that we could try to help fill the gaps of the social determinants of health.
Mm.
A lot of my patients, they can't figure out a way to get to the doctor. They can't figure out a way. I can tell them these are all the things you got to change your life about with your diabetes. But also coming from, as you guys know, you guys come from a minority home, like I can't just tell a family member like, you shouldn't eat those neck bones. You know what I mean? Like they know that they shouldn't, but it's like if we've been eating the way we've been eating, or if we're not used to exercise consistently for 30, 40 minutes, 5 days a week, you're giving a person a lot to chew on, no pun intended, right away. And so when you're able to let them know, trust me, it's going to take a while, but I'm here to support you because I know how difficult it can be to change your life. And I know what epigenetic traumas that you've been through because I go through them because we're family or we're both, from the same background or something. So
Yeah.
that's what kind of keeps me going is like, you get that one person or that one student or that one patient that was like, you really like, there's a light bulb that click after talking to you, and all you need to reach is one.
That's awesome. You really are an inspirational person. You're reaching more than just one person. I know that for sure. You're reaching
Sure.
tons of people.
I was gonna say also, I wish we had a pharmacist at our clinic, but just our inpatient service. I trust the pharmacist, like the pharmacists we work with so much, and I call them all the time, and they're always so nice. I
Yeah,
call
I
them
get
at night.
calls at 10 o'clock at night from like preceptors that are like 60. They're just like, girl, can you help me with with dosing the Cipro? And I'm like, yeah,
Yeah,
sure. Yeah.
no,
I don't
everyone's
care,
so
you know?
helpful and so nice. I called someone at like, I mean, they were on call, but 11 p.m. or something on my night shift. And I was like, hey, I know this is kind of dumb, but like, can I start this if they're already on this medication? Do I need to wait? And they're like, oh, no, it's fine. And I don't know. They help me with everything. So I love
Yeah.
pharmacy.
I
That's
got a patient
awesome.
like that this morning, and my colleague was just like, how common is tendonitis? I'm like, it can happen, I don't want QT prolongation because you guys
The answer, though, do you like fluoroquinolones?
yeah, yeah, it was an 88-year-old patient with like this awful UTI, and they're like, "Can I give them this?" And I'm like, "You could." Well, they're on amiodarone. What are they gonna do? And I'm like, I mean, it could be QT, but I don't want them to fall down the stairs confused
Yeah,
because of, their UTI. So I'm also there to be realistic about the risks and rewards, but we can only do what the patient allows us to do. So,
that's
you
true.
know, you
That's
just
awesome. I love the interconnectedness of like fields and how we're relying on our networks and like the people we know and to combine forces for the greater good. I love that. I love collaboration like that because we're
it's
all
fun.
experts in our own field and our own subject matters and the experiences we've had. So when we combine that, it's just so powerful.
It is. It's impactful. And you guys are doing such great work. Richard, you've been doing this for, whew,
Thank you.
geez Louise, since you were a grad student. So,
Thank you.
The next question we have for you is, what are a few of your biggest priorities for 2025?
priorities. Definitely more publications, but also just in general, you guys get to like my age. It's really just maintenance of peace.
Nice.
That's it. You just want to maintain peace and you want to maintain discipline. Because if you guys think about it, you've been a student since you were when you go to kindergarten, like 4 or 5,
Five
and then
for
you
me.
go, right, you go to grammar school, middle school, high school, college, then we're all, kind of low key insane because we're like, let's just be in medicine. Let's just go to grad school. Like and then let's get a fellowship and then let's do a residency. And then you're like, by the time you get out, you're 29. And a lot of people I've met, including me, kind of go through like 28, 29, like an existential crisis. Like I've been someone's daughter, sister, friend, and student all this time. And then you get into the workforce, and after a year or two, you're like, this is it. And then it's like, yeah, this is it. This is what it is. So what I'm seeing right now, and I think you guys have seen it too, where a lot of our colleagues are like, oh my gosh, like this is it. I don't know if I like this. When really we have to raise our ceiling so we can grow higher. So this can be a resource to help you maintain a lifestyle that you want and give back. But also, what are some things that give you peace outside of this that help you grow? And so I want to continue finding things that continuously help me grow both in my profession and also both outside my profession.
That's awesome. And yeah, it really goes into challenging yourself, but not to the extent where you lose your peace. But if you're not challenging yourself, you're not growing. So that self-actualization, you're having to maintain, you're in a place where you feel happy, you've attained a lot of the major accomplishments you wanted to set out in your life, but you're not done. There's so much more that you want to accomplish, even though you're very successful, and that's natural. So, like, saying that out loud is just very insightful and could really help a lot of people because it goes to show that the arrival fallacy is something that a lot of like people in school suffer from. So it's like, oh, when I get to this stage, I'll finally be happy, or when I get to the other stage, I'll finally be happy. But you just have to enjoy every chapter. But you could also look forward to what's ahead. So, with that in mind, what do you aspire to accomplish within the next 5 years? So, what comes to mind? So, 5 years from now, what would you like to have done within that time? So, you said more publications. That was more so for this year. So, think a little bigger.
I'm a type of a person, I don't even know what I'm gonna eat the next day. So when people ask like these big, long,
Valid. No, that's valid.
yeah, I'm like, I don't know. But I've embraced the I don't know because I don't have a destination. I have a journey I want to be
That's
on.
beautiful.
Yeah, I don't have like a because we remember we're in medicine and we're in
Yeah.
big healthcare, so we're always used to at this step you take your capstone, and then at this step you take your boards, and then you get a residency, and then you do this, and then you're gonna work at a big hospital, and then you're gonna do this, and then once you get those things, that's great. But then also, what's next that's gonna fulfill you? I think within the next 5 years again, my biggest goal is to just keep continuing to maximize my peace and my space and being at peace with whatever I can control. So if your job is acting up or this and that, it's like, okay, how can you control it? So just increasing that awareness. Also, I would love if I could write a couple more grants that really instill a lot of support with DEI right now, with making all of everybody who works together, no matter where you come from, feel included. And then anything I can do to increase awareness about mental health and safety with that. I don't have like a specific thing
No,
like
that's awesome. That's perfect.
yeah.
That's literally that's beautiful. That's what I wanted to hear, sort of general ideas of like, when that question's asked, like what innately comes to mind? Like what, something that you haven't really thought of and it's a passion project and you said it. You stayed true to your core. And I love that.
I try to. It's tough,
It's
man.
hard. It is a hard world.
I was just gonna say, it sounds like you're an incredible mentor to a lot of different people. What advice would you offer to those who wish to pursue a career like yours?
Maybe just reiteration of like what I said earlier. But the biggest thing, of course, with medicine is, do you want to do this or do your parents want you to do this?
Hmm.
Yeah.
Uh, right. And then how is this making you feel fulfilled? I have students that get into pharmacy and they get to like their second or third year, and I could tell they don't want to be there. because they'd rather be a musician or they'd rather be, in childcare. They'd rather be whatever. And I know I have had a couple classmates that they work for 1 or 2 years and they're completely done with pharmacy.
Mm.
They're like, I don't have anything to do with it. And it's because they did a brave decision of what is this doing to fulfill me? And it's not checking off any more boxes. Why am I here? Why
Yeah.
am I here? It's okay to be brave, to walk away and to do it as long as you can while you build your plan. So that's what I would encourage. You guys are so sweet about being a mentor. I don't see myself as a mentor. I do mentor people. I sometimes I like kind of like have to like double back and like, oh my gosh, you think I'm doing so many things when really I have to remember to not self-sabotage and remember that
Hmm.
I a lot of stuff and what I do does
You're
matter.
doing a lot of
Yeah.
stuff.
Yeah, you do a lot. Yeah, that inner saboteur, no, and that we got to change that negative self-talk. Nope, you are a mentor. You are a powerful human being that has a lot of skills. And you were mentioning how you do it for your students. You were mentioning how you do it to inspire the next generation. So you totally are a mentor, giving advice. The advice you give, it's very, very direct, and a lot of times directness is it could be said in a rude way, but you don't give it in a rude way. It's very, very insightful. So thank you.
Well, I mean, it's best to reach people as much as you can because remember, in our profession, everybody's smart.
Yeah.
Everybody's smart. But how do you say things? Especially with this profession, I should say too, it can get a little monolithic. So
Mm,
it could be like the guidelines say this, so do this, or this is black and white, because science is black and white.
yeah.
But uh, my
Science
therapist,
is also an art, though.
it's an art. It's an art. There's a gray area that you have to move with the whole patient. You have to see the whole picture and tailor like you're a haberdasher. Like you're just like, I have to make this specifically for you. But before I tell students too, and other people in my life, before you speak, think about your words and is it true? Is it kind? And is it compassionate? And if it can't check those boxes off, what will you have to say? How will that improve the silence? How will that improve the person? You should really do your best on the best of circumstances to make someone that enters the room with you feel better about themselves than they did, entering. They should feel better about themselves leaving your presence. They should feel like, when you walk into a room and you're like, somebody walks out of the room and they're like, she smells good. Like I have a faint scent of her perfume. That you should feel that after an interaction with someone, if they're a positive, compassionate person. You should feel like there was something about her or him where they kind of made my stomach warm because they just saw me. And most of the time, people just want to be seen and they want to be understood. And another thing, I tell my students all the time is because when you're in your 20s and you're a student and all this pressure's on you, you're like, oh my gosh, a quiz, the world is
Mhm.
ending. I kind of tell my students, before you freak out, the lips of wisdom are only open to the ears of understanding. A lot of this stuff is bigger than you, but then a lot of stuff that we carry, especially with anxiety, with mixed anxiety and depression, it's rooted in a lot of stuff that has nothing to do with us. I'm not saying that for every case, but I tell my students, watch your diet. And they're like, oh, we eat healthy. No, watch what you watch on Instagram.
Yeah.
Watch what you watch on TV. Why are you watching all of this garbage about housewives catting and why are you watching? How does this fulfill you? How does whatever is on Instagram fulfilling you? How is scrolling as soon as how why is scrolling the first thing we do when we open our eyes? That's not allowing us to sit with our thoughts and with our processes. And so to answer your question and took forever to land, I would hope within the next 5 years we get some type of ordinance or something that allows us to step away from social media for 48 hours once a month. Like we have we have to start learning to sit with ourselves because if we don't sit with everything, we'll miss everything.
Yeah, sometimes we just get so caught up like being in a cycle and a routine that, we don't stop to reflect. And it's very important to have that self-reflection and isolation, like where you get to experience those emotions and feelings. So very, very wise stuff that you're sharing with people and with us. I'm grateful to be hearing it from you. So,
I was just gonna say that it's something I've been trying to work on as a medical resident. Because I think in medical school, like it's funny when you're applying to residency, they ask what your hobbies are, and you're like, I don't remember.
I
Like,
remember.
what were they? But I've been trying to like find like my hobbies back and find new hobbies. And the thing that I told the interns this year, was like if medicine was taken away from you, if your job was taken away from you, who are you? Because at some point, like medicine might not be there, or you had a bad day, or your patients are mad at you. So, like, if you truly identify who you are through your job, that's a tough spot to be in because not every day is gonna be good. You're not always gonna feel fulfilled, and you're gonna have people who are mad at you. And so, trying to find those things that I would describe myself as, what my hobbies are and what I like to do and who I am outside of that, I think is something I've been trying to really emphasize the past year or two.
You should. And I think when I was in a mental place that wasn't the best after residency, my fellowship. And I was like, oh my God, is this who I am? And you don't want to start getting into bad habits and a bunch of stuff. I started doing Legos and I try to do a set every month or so now, and I still do it. So
that's
stuff that
awesome.
yeah,
That's
I'm
That's a
obsessed
big
with.
challenge. I struggle with like anything with like architecture or geography or
me
like where
too.
things go, puzzles.
I'm terrible at Legos and puzzles, but that's so fun.
Yeah, I did a Christmas Day. I did a jigsaw puzzle. Like I was like, I'm just gonna do like a puzzle, like, because when you're in your 30s and you're single and you're just like, oh my gosh, the dating pool is awful. You have to figure out what you want to do. You don't want to sit on your phone all day or swipe or meet random people, and you don't want to go out to the bars. You just want to sit at your house and listen to an audiobook and do puzzles. So I wasn't there at y'all's age at that time, but I wouldn't be surprised if you guys start getting into it in the next couple of years. You're like, what do I do to turn my mind off that doesn't have to do with trash TV? It doesn't have to do what's going on in the news. You don't even want to hear about it, So you'll probably circle into like just walking around not shambling, this is Jacksonville, but walking around like, Barnes and Noble, like what type of little craft can I start making or something? You guys will find it. You guys are still growing in your career, so you're really busy with tasks. But when you take those tasks away, you're now you think in your mind, you're just like, I can't wait to not do this stuff. And then you stop doing it, and then you're just like, wait, like, what do I do? Like, what do I do? And you want to still be creative. So you guys are doing it now with this. Like this.
Aw, thank you so much. I
It's
was
good.
thinking of something else too, like more personal, like um with like I have a sewing machine, so I wanna with my partner, I wanna get into like, doing some outfits and whatnot. I don't know. But I have it, so I need to just learn
That's so
and
cool. I didn't know that.
That
yeah.
is such a big deal. You are like surpassing us on the scales, man. Like that in
It's
gardening.
that it's so hard though, but I'm committed to it. But once I finish these like responsibilities that I've set out to accomplish, I do want to start integrating before because school's gonna wrap up for me soon, and I'm gonna want to integrate back into like the real world, like you're saying, and having to establish myself, and I want to have those hobbies set, and I've been working on it, and the sewing machine has been bought. I just have to uh finish those lessons and then take the next step. But
That's a
I'm excited. I'm excited.
that's a big deal.
Thank you.
You should be so proud of yourself. I
Thank you.
mean, even it's little stuff like that, like Michelle, like you could try sewing. I still knit, like I crochet. Like it
I
sounds
started crocheting. It's pretty
amazing.
cool. I don't know if I'm skilled enough to sew, but I think that's such a cool skill to have though. I would love to.
Oh, Richard is like surpassing us on like the
I
accomplishments with.
know. That's awesome.
Y'all are so sweet. So, um, so what is one book or podcast outside of ours that you think everyone should experience?
Yours. Um,
Thank you.
um, it depends. It kind of just depends on what you're into. I read a lot, so I kind of I'm like I like to read like a couple things at a time. So I'm like reading Devil in the White City, but right now I just got we have a book club with the residents that I joined. Right now I've been insanely obsessed with the Fourth Wing series.
Are you reading Onyx Storm?
I'm so behind. I just started reading The Fourth Wing. Like I'm on
Okay, okay. The third one just came out. That's what I'm reading.
yeah, like that's what all of the medical residents are reading. And I'm like, y'all. So that's been a fun project to like listen to when I'm driving audiobooks. That audiobook, because I don't know what's going on with Violet, but I'm so like I'm trying to figure out what's going on with that Xandar guy, Xanax, whatever his name is, and then her
Yeah.
other right here, her other old boyfriend's getting on my nerves. It's stressful, and I like the stress. But other than that, podcast wise, I like a lot of like culture podcasts that kind of talk about people's takes on like what's going on in the world, and then a lot of true crime. True crime is my life.
Any recommendations specifically?
I'm obsessed with fraud. So scamfluencers, there are these two young ladies from Canada, and they live in New York, and they have one of the best scam podcasts. And then um, Swindled.
Okay,
Swindled is great.
I'm gonna check it out.
And then I'll text you some too,
Oh
where it's
yeah,
like,
that would be great. I would appreciate that. Thank you
yeah.
so much.
Okay, so I think that takes us into our next segment, Bright Talk, where we discuss complicated topics in hopes of shining light on the matter. This week, we will be discussing the power of self-love, implementation of science, and art perspectives. So, just to get into a little bit of background before we start talking as a group, through a thematic analysis review, it demonstrated that there were three main themes to self-love.
So, with self-love, there's three main themes that were found through the thematic analysis. It was self-contact, so that's giving attention to oneself, self-acceptance, being at peace with oneself, and self-care, being protective of oneself and caring for oneself. So, more research is needed examining the link between self-love, psychological health, and well-being.
With this in mind, let's go ahead and start off with some of our questions for this Bright Talk topic. The first is, what are some techniques you do or recommend for others to engage in the main theme of self-love, like self-contact?
So I do go to therapy. I'm avid on going regularly. And of course, I try to thank my higher power for allowing me to move my body as often as I can. So that helps. Chemically, it helps too. But other things that I do for self-love, I really had to work on, as you guys see, I still need to work on it, but I really need to work on affirming myself within without validation from someone else. So making sure you look in the mirror every day and you say, and I had to learn this after a toxic relationship. I had to look at myself in the mirror and say, I did not deserve what happened, although I chose a situation or whatever it could be. I chose this for myself, but exercise is like telling yourself, younger Sam is going to be okay. And right now, of, you need to tell younger Sam that you are insanely loved and that you love yourself and that you will never, ever, ever be in a place willingly again where you cannot hug yourself and say, this is, I'm proud of where I am today. So I try to affirm myself with different exercises like that as much as possible. But those exercises I've gotten from consistently going to therapy.
That's awesome. And you did a really good job answering the question because you blended uh like two different themes with the self-contact, having to a mirror and you talking to yourself. You're engaging in that self-contact with yourself just by having that conversation and affirming. And then the physical touch and self where when you're saying those affirmations, you're touching yourself in your chest or your face. You're affirming yourself that you're worthy, you're beautiful, you're great. Like having that self-affirmation and that self-contact, you were blending self-acceptance too with that self-contact. So with the next question, what is some advice you would offer to those who wish to grow closer to self-acceptance?
Honestly, it's just reaffirming within yourself with compassion and gentleness.
Mindfulness, yeah, removing that judgment. So removing that judgment, you create a more peaceful environment inside your mind.
And
Um,
then also removing hot take, guys, hot take. Hot take, hot on the press. It is perfectly okay, especially when you guys get deep into your 30s. It is perfectly okay to have healthy boundaries with people that you used to be close with. And it is perfectly fine to surround yourself with people that are committed to consistently pouring into you and also committed to advocating that you pour into yourself without judgment. I think when we're older, when we're younger, we hear situations and we're like, oh my God, like, why do they do that? Oh my God. And over time, we misunderstand how harmful that is because we start thinking about life in their lens. And then we start making decisions like, what are they going to say about this? I can't wear this. I can't do this. I can't make this decision. I can't without their input or without this. And then all of a sudden, we're noticing like, that's not what social media says. And we're not leaning to an understanding that's based upon a foundation that is healthy for us. It's healthy to the perception of what society tells us we should have, but that's not that it's okay if that's not who you are. And then when you start realizing that it's okay to walk alone or walk in a smaller circle moving forward, because everybody can't go with you,
Mhm.
but you have to be okay with yourself. And that intimidates a lot of people when you do those affirmations of self-love and you start understanding people only treat you as well as they treat themselves. So if you start treating yourself really good, you're gonna start noticing like I really feel like I'm really not around a lot of just stuff, or I'm really not around a lot. Like I really don't have a lot of input. I really don't have a lot of stuff on this person's life or your life or whatever, because I'm too busy walking and affirming my own self-love and my own self-worth. So that's the only thing I would tell younger people is be try to figure out some activities that really affirm with leaning onto your own understanding of what loving yourself should look like.
Beautifully said. I love your answers.
It's hard. It took a while. It took a long time.
That's wisdom, though.
Yeah, it took it. And honestly, fully transparent. When did I meet y'all? That was probably one of the worst times of my life when I met y'all.
Really?
Really?
Yeah. I was in an awful relationship. I had anxious attachment issues. So it's like, how come they didn't text me? How come they're not? And I just had no confidence. I was like, oh my gosh, what am I gonna do if I don't get married? What am I gonna do? What am I gonna do if he doesn't this? Oh my God, is this happening? Who is he talking to now? What is this? What is this? And I was living for another person, and people make mistakes, but I always tell people this, Peter had a bad day, Judas has a bad heart. And you want to surround yourself with Peters
Yeah.
instead of people that can harm you. Because once again, people can only love you and meet you where they're at. They can't, and you can't change someone. You have to. So at that point in my life, I didn't even know how dark and sad I was. And so now looking forward, what, 5, 6 years later, it's like, whew, but you have to get to a place where you truly, truly choose loving yourself and like really trying to because you hear that all the time, like, you got to love yourself. A lot of people have no idea what that means.
Yeah.
They have no idea what that means. And that's
Yeah.
okay. You got to figure out how that works for you.
Yeah, I'm really, really proud of you, and thank you for sharing. I've, been inspired by you for years and have always wanted to collaborate and work with you, and I've been grateful to work with you. So for that to have been your worst time, I'm grateful for what's ahead because you've conquered, you've overcame, and here's to better.
Thanks, Richard. You guys so sweet.
I was gonna say I'm proud of you too. That's awesome. Um,
Appreciate.
the last one, and you've given us a lot of really great ideas for self-care and how to incorporate self-love. Do you have any recommendations or techniques that you tend to tell people to help engage in those things consistently?
Yeah, I would say journaling, reading, because it's just like with what did I talk about earlier? Like with diabetes, and you're just like, oh, do
Yeah.
this because the American Diabetes Association does this. So it's the same thing with all of this, you know, rhetoric about try yoga, do this, do that, meditate, try sound baths, try whatever you want. However, I would say start small, just like with anything. If you take 5 minutes to journal in the morning, it can be on your iPhone. I would prefer if people write it down because there's something about the energy of using your hands to write something down and it releases out of you.
Hmm.
That's all I recommend. It works
Yeah,
for
no,
me.
there's a bunch of studies out there that, the act of writing something out goes a lot further.
Writing something out, painting it out, whatever you want to do. And then I forgot to mention this. I've read it now twice. It's called I can probably send it to you guys later, but it's called The Untethered Soul by Michael Singer. And that was a game changer for me. Because it's really, it's not so much a self-help book, but it's for you to see yourself from different angles. And you want to draw upon different aspects of your life. And it's not so much like a super religious book at all, but it offers, I don't want to, actually, I want to correct myself. It's not a religious book, but it is about the inner faith that you have. So I would recommend anybody kind of just start there if
Yeah.
they.
And there's a lot of misconceptions with like spirituality. Like there's a lot of studies out there that, state that in individuals that don't have spirituality, which is just like having some sort of faith or some sort of belief in a higher power or some sort of understanding of how the universe operates, not having that is more likely for someone to experience depression, to experience sadness, to experience mental health conditions. So, it really does put into perspective the importance of self-reflection and finding what your values and your belief of the world is and exploring that. Um, yeah.
Absolutely. And I'm so glad you said that because it really shines a light on. So I'm Catholic,
Hmm.
but I converted to Catholicism when I was 18. So I was like, I went to Catholic schools and stuff. Amazing decision. I love it. I still go to mass. However, I remember I had a teacher, her name was Sister Teresa, and she was funny. And she used to be like, you know, God didn't create religion. God created man. And so since he created men are always going to be flawed. So if that's the case, then religion is flawed.
Yeah.
But God did, however, instill in us faith.
Yeah.
And so I think a lot of times when people get into weird relationships or they get into like these different type of dark places, no matter what it is, like what you said, a lot of mental health issues, it's not like a give or take thing every time, but you have to have almost like you have to have a base
Yeah.
planted, a pillar to go back to, because the boat, that's why it's called the untethered soul, because if you think about it, a boat that just wades in the water, it could go anywhere. It could crash on any shore. It could sink. But if it has a place where it's tethered, life is the wave. So it's going to be crashing up and down and a mess. But if you're tethered to a dock that you know is centered in a good route, it is going to be a lot harder to be susceptible to being just crashing against just anything. And so, I'm not telling anybody to just like dive into, the Bible or dive into, the Quran or whatever. But what I am saying is, in a lot of these faith bases in spirituality, trying to figure out your place in this big universe and understanding that things are a lot bigger than you, but you are also here for a reason, and you are meant to be here. Like you are meant to do something in this universe, and you are not here by accident.
Wow.
Yeah, that's beautiful. I
That's a
agree.
beautiful, beautiful way to like conclude the podcast, because that's epic, honestly. Um,
You guys are so
I
sweet.
love your way of thinking. I really do. I am grateful that we were able to have you on the podcast and share this with the world, because I felt impacted. I'm sure
Oh,
other people will too. So thank you, thank you, thank you so much. Um,
No, even just us, I feel like we're already taking a lot away from it, especially about the stuff you're saying about relationships and kind of growing. I think that's something that I mean, I'm in my late 20s, but something that I've been like painfully trying to figure out. So I think I took a lot from that conversation as well. So
girl, that's it. Y'all should do a relationship episode, because this, because what people don't want to talk about too is like hot take. Or do you and your partner share things and love on things and talk to each other and love on each other? And that's great, but a lot of times, because we're untethered, especially you guys are gonna see this in your 30s, because you have a couple more, skid marks on your behind after that. You've been through some stuff. You're gonna notice people start trauma dumping, and then
Mhm.
you're gonna start trauma bonding. And then all of a sudden you may end up with what's called a wound mate. So it's like, did you guys really get to know each other? Or are we sharing traumas and have similar traumas, and we're not working on them? We're latching, but we're not working on them separately. And I always tell some of my younger girlfriends who are like, what am I gonna do if I don't get married? And I'm like, well, you're still gonna convert oxygen to CO2, believe it or not, and the sun's still gonna rise. But if this is really a goal for you, why do you want, I want someone to make me happy. No one can save you, and no one is going to make you happy. They can adjunct your own happiness, but you have to find your own joy. And that's a lifelong mission, y'all. So
yeah, yeah.
that's a
Valid,
James
valid
Bond,
points.
that's a James Bond mission. That's for real. But yeah, thank you guys so much for having me. This was one of the best things. This is a wonderful way to start out 2025.
I agree. I agree. Thank you so much.
I
I'm happy to
appreciate
have
that.
you. It has been such a pleasure being able to interview you on our show. That was such a wonderful conversation. And that's it for episode 4 of season 2 of Project Brightside. Thanks for tuning in and supporting us. Make sure to recommend our podcast to your friends and family. Also, make sure to keep sharing. We have a lot more in the works for season 2. So until next time, take care.
Episode 4 of Season 2 of Project Brightside was executive produced by Richard Brito, Shelby Flohr, Lou Curiosity, John Scrivenich, Jay Curiosity, Sophia Paez, Andres Gil Arana, and Zoe Rushetsky. Music by Jay Curiosity. Edited by Luke Riosti and Richard Brito. And a special thanks to Dr. Sam Thompson.